Hi, my name is Nico. This is going to be the question portion of my abdominal assessment. Firstly, I'd like to know if my patient is experiencing any abdominal pain, if there's been any nausea or vomiting, and if there has been, how many times they have vomited and what that vomit looks like. I would ask how their appetite is, if they've lost their appetite, if they've had any sensitivities to any food or any intolerances that are recent or they've had from the past. I also want to know if there's any medical history relating to the GI tract, relating to the chief complaint, and if they've had these symptoms before, as well as any pertinent medications that they could be taking, the reason for those medications, and if they are compliant with the medication as ordered by a doctor. I'd like to know what their bowel movements look like and what the frequency of those bowel movements is, if they are well hydrated and they drink enough water, and I'd like to know how often they're going to the bathroom to pee and what that urine looks like, if it's cloudy, if it's clean. Hi, my name's Nico. I'm going to be doing my abdominal assessment on my patient Jaden. For the purpose of this video, I do not have gloves because I ripped them, unfortunately, and my safety goggles broke this morning. But with a real patient, I will be wearing appropriate PPE, being gloves and safety glasses as well. All right. So Jaden, what I'd like to do today is perform an abdominal assessment on you, which consists of a couple of things, right? So number one being me visually inspecting your abdomen. So what I would do is raise your shirt just enough so that I can see your abdomen. I'm going to look for any abnormalities, for anything that could potentially hint to me that of what could potentially be going on. Is that all right with you?
Yes.
If at any point you have any questions, please feel free to let me know. And if you're not feeling comfortable with the exam, you can let me know as well, and we can stop and we can go from there, okay?
I am comfortable with it.
Perfect, all right. I won't be raising Jaden's shirt for the purpose of the video. Also, it's cold. But with a real patient, I would lift the shirt just above the abdomen so that I can have a good visual of the area. All right, Jaden, so I'm just gonna lift your shirt. What I'm looking for is I'm looking for any pulsating masses, any abnormalities, any scars, any needle marks, any medication patches, any pulsating masses, or if there was any bruising to your abdomen, okay?
Okay.
Perfect. The next part of my assessment, Jaden, is going to be me auscultating your abdomen. So what that's going to consist of is me taking this stethoscope. I'm just going to place this end on your stomach. I'm going to listen to all four quadrants of your stomach. What I'm listening for is adequate bowel sounds. So we're listening to see that your intestines are moving appropriately, and I can ensure that there's no blockages or any abnormalities. Is that all right with you?
Yes.
And again, if you feel uncomfortable at any moment, please let me know.
Okay.
All right, I'm just going to start here. Sorry, it made me cold. It's okay. Okay. Now, for the purposes of this video and the time limit, I have cut down the time that I'm auscultating the abdomen. Normally, I would auscultate for about 10 seconds. If there is no bowel sounds heard, I would extend that time to ensure that I properly hear the bowels. The next assessment I'm going to be performing is percussion. So Jaden, what this is going to consist of is I'm just going to take my hand, I'm going to place it over your abdomen. They're all 9 segments of your abdomen. I'm going to use my other hand to palpate or to tap onto my fingers. What that's going to do is it's going to let me listen for any resonance or any dullness in your abdomen, and that could indicate potentially fluid, air, or the organs that I'm feeling. Is that all right with you?
Yes.
And again, if you feel uncomfortable at any moment, please let me know, okay?
I am comfortable.
My hands might be cold, I'm sorry.
It's okay.
All right, Jaden. So I did not hear any abnormal sounds during percussion, so now I'm going to move on to the next part of this assessment. Jaden, what that's going to consist of is I'm just going to be percussing, starting right around your sternum, all the way down until I can hear the difference in sound, which will indicate to me that I've reached the border of your liver. And I'll have you place your hand there for me. I'll start from lower down in your abdomen again, percuss my way up until I feel the lower border of your liver, just so I can tell if it is inflamed or if it is an adequate size. Is that all right?
Yes.
Perfect. And I'm going to be using my hand just right down the middle of your sternum, okay?
Okay.
Okay, can I have you just place your finger right there for me? Perfect. And again, I'm just going to start lower down, okay? And if you feel uncomfortable at any moment, let me know. So right around here, perfect. And I'm just assessing that the liver is an adequate size, that being anywhere from 10 to 12 centimeters. Now I'm going to be moving on to the specialized diagnostic test of my assessment. Firstly, I'm going to be doing Murphy's test. So what this is going to help me do is rule out the possibility of cholecystitis. Okay. So Jaden, what I'm going to do is I'm just going to be palpating right underneath your right rib. What that's going to do is it's going to allow me to feel for your gallbladder. I'm going to get you to release all of your air in your lungs. I'm going to place my hand right there, and then I'll get you to take a big breath in. If you feel pain, please let me know and we can stop there. That'll just give me a hint of whether we have a liver issue going on or whether we can move on to a different diagnostic. Is that all right with you?
Yes.
Perfect. All right. So I'm just going to have my hand right under here, next to your ribs, right under your ribs. Okay. I'll get you to take a big, big breath out. So let out all of your air. Perfect. And I'm just going to place my hand here and big breath in. And was there any pain?
No.
No? Perfect. So because there was no pain, this would be a negative Murphy sign, meaning that I don't have a reason to believe that there is cholecystitis. So I'll move on to my next assessment. My second specialized assessment that I'm going to be performing is Blumberg's test. So what this is going to consist of, Jaden, is I'm going to be pressing into your abdomen, okay? What I'm looking for is something called rebound tenderness. So that is going to be as soon as I take my hands away and relieve some of that pressure. You may feel some pain. It won't feel comfortable, I won't lie to you, but I just need to know, and that'll give me some idea of whether there's some irritation and the layer that surrounds all of your organs, okay?
Okay.
All right. Okay, so what I'm going to do is I'm just going to press firmly in, okay, and I'm going to let go and you let me know if you feel pain, okay?
Okay. No.
No pain at all?
No.
Perfect. So the negative Blumberg sign is letting me know that there is no peritonitis, so I'm not concerned for any irritation or bleeding inside the peritoneum. Next assessment that I'll be performing is going to be bilateral blood pressures. This is going to help me either rule in or rule out the possibility of a AAA. What I'm going to be looking for is if there is a 20 millimeters of mercury discrepancy between both arms, it could be indicative of cardiovascular disease. If there is a difference of 40 or more, then it is indicative of a possible AAA. All right, Jaden, so what I'm gonna do is I'm just gonna take your blood pressure on both arms, okay? All that's gonna do is it's gonna help me rule in or rule out one of the conditions that could possibly be causing some of the pain and discomfort that you've been having, okay? What it's gonna consist of is me placing this cuff around your arm. You might feel a little bit uncomfortable, a bit of a squeeze on both sides, but if at any point you feel uncomfortable, please let me know and we can stop. And if you have any questions, I'm happy to answer them. Is that all right with you?
Yes, that's
Yeah.
good with me.
Perfect. All right, so I'm gonna start with your left arm. Okay, I'm just going to place this cuff around your arm here. If at any point, again, you feel uncomfortable or you have any questions, please just let me know. Don't hesitate to interrupt. And I want you to know that any information that I collect from this, whether it's your vitals or any questions that you answer, will remain confidential. And they'll just be for me or your care team at the hospital. Nobody else will have access to them, okay?
Okay, thank you.
Perfect. All right. Oh. Okay. Now, I did have gloves, however, I have unfortunately ripped both of them. So for this procedure, I would be wearing proper PPE, being gloves and safety goggles as well. All right, I'm just gonna place my stethoscope right here into your arm. Okay, just a bit of a squeeze, Jaden. Stay as still as you can for me, okay? Jaden, so So your pressure on this arm is looking good. It was around 128 on 86. Okay, now we're just gonna do the same on your other arm. And you're still all right with this?
Yes.
Yeah, no discomfort, no pain at all?
No.
Perfect. All right. Sorry, I'm just reaching in here. I got these all mixed up.
All good.
Okay, I'm going to just clip this guy onto there. Perfect. I will have this here. All right. And again, if at any point you feel uncomfortable or you feel any pain, please just let me know and we can stop, okay? I'm just gonna raise your arm. Great. And once again, stay nice and still for me, okay? So your pressure on this arm was around 126 on 72, so both pressures are good on both arms. Because there is no discrepancy or no large discrepancies in the difference between blood pressures, I am going to rule out the possibility of a AAA.